Hey, Dr. Vicky here. So let's talk about that spinal cord injury case that I mentioned. And I talked about it on the podcast last night. But what I want to talk about is his presentation was after spinal cord injury. He had balance issues. His gait was off. His left side was had shriveled up, very small. He had some sensory loss and pain and temperature on one side of his body. So we had to look at the spinal cord tracts and see which ones were not firing properly. So that means the brain isn't getting integration. So if you don't have information coming up those pathways, the brain isn't getting that integration. So we needed to do some things to kind of wake it up. And yesterday, and I didn't know if it was going to help with the pain and temperature or not, but when we got done yesterday, he was able to feel the cold, because I had a cold pack, and he was able to feel the cold as long as it was a large cold pack. I tried a smaller surface area, and it wasn't there yet. So we got a ways to go. But this was only our second treatment, and I saw huge improvement with his gait. So when he walked out the door, huge improvement in his postural tone and his ability to control his left foot, which usually will slap the ground because he doesn't have any proprioception, which is the brain telling the body what to do. So you have to have that awareness in the brain to be able to effectively do that. So that was pretty exciting. I will keep everybody updated as far as what we see with this gentleman. And if you know of someone that might benefit from my neuro rehab, my number is 303-385-3432, SouterChiropractic.com.